Hello, everybody. Welcome to the second module. In this module, we will discuss the science and professional practice of sport and exercise psychology. Now, when we talk about a science, keep in mind that we have a couple different definitions that we associate with the word science. So we define science as a process or method of learning about the world through a systematic, controlled, empirical, and critical filtering of knowledge acquired through experience. Another way to think about that definition is like this. If you want to look something up, you don't necessarily always go to the first source that you find because you know that sometimes you can run into a lot of misinformation, a lot of biased information. Going through a process or a method that tries to disseminate what is valid, what is reliable, what is coming from credible sources, that is the basis of science. Now, whether that's done through studies or various experiments, that's something that we'll talk about today. And ultimately, in that process, thinking back to some of the questions that we presented to one another in the first chapter, as it relates to some questions that may arise from you reading the different chapters in this text and some questions that I'll propose to you throughout the semester, we want to do everything we can to, of course, try to find answers to those questions. And we typically find those answers in the context of theory. So theory ends up being the ultimate goal of science, of the science of sport and exercise psychology. Again, science being that rigorous process through which we're trying to find the answers of. And the answers are not always clear cut answers, but again, the answers can be and typically are, especially in this discipline, in the form of theory. So, if theories are what give us the answers to some of those questions that are related to topics that we'll talk about this semester, what exactly is a theory? Well, a theory is something that seeks to explain a phenomenon, a situation that's going on, and it does that through typically derivatives of the following constructs: describing, explaining, predicting, controlling. So a theory may seek to do all of those things, some of those things, as it tries to provide us answers with problems that we encounter or again questions that we are trying to answer. Thinking back to the science of the discipline, again, sport and exercise psychology is a science. For something to be considered a science, it has to be systematic, controlled, empirical, critical, and all of these words, I think most of them are pretty self-explanatory. You may be a little bit unfamiliar with empirical. Now, what empirical means is related to searching something and not just necessarily from word of mouth. Now, think about, and this ties into perhaps more so my current discipline because I'm an athletic trainer. Let's say in athletic training, there is a treatment that you want to perform for a patient, and the only reason you are doing that treatment on the patient is because somewhere, someone along the way, maybe someone you considered your mentor, they told you that it was a good idea and they said that it worked and you didn't necessarily consider anything else. You trusted that individual and you kind of just went by with what you were told. Now that is anecdotal. An anecdote is a story. So if you're doing something because someone says it works or because someone says that it's a fact and you don't necessarily look into it, that again, that is anecdotal. Empirical is different because what you're doing with that type of mindset is instead of just taking what you hear at face value, you're digging in a little bit more. So you're asking questions such as, why is this treatment working? Or does this treatment work for this patient and not for that patient? So as you see, again, we start to put a little bit more rigor in the questions and ultimately the answers that we find. And these other components, systematic, controlled, critical, of course, systematic, the process in which you're asking these questions, again, whether asking the questions and then trying to find the answers through a study or an experiment, has to be organized, controlled, particularly when we talk about experiments. There has to be a level of manipulation involved, particularly when you start thinking about things like control groups, experimental groups, which we'll talk about next, and critical. You have to put your resources, you have to spend your time on questions that are worth finding the answers to. There's no sense in doing research and looking into the science of things that are irrelevant or don't contribute to any form or fashion of a particular discipline that you're interested in. In this case, that relates to sport and exercise psychology. So, text definition of theory is a set of interrelated facts presenting a systematic view of some phenomenon in order to describe, explain, and predict its future occurrences. Like I said, a fancy way here of saying that a theory is a way to reach an answer to, again, questions that are presented based on real life problems. And typically those problems arise from phenomenon, right? Phenomenon are things that cannot be explained right away. Well, laws, essentially laws of science, laws in different disciplines. You might have heard of, law of gravity, so on and so forth. Those things arise from theories, and theories again arise from trying to find ways to explain, predict, describe phenomenon that occur as a result of real world problems or just observations. So one example that you might see is a social facilitation theory. We're going to talk about this theory more throughout the semester, but essentially, the premise of this theory is that individuals are typically much at ease, and they can perform certain behaviors much easier, much more comfortably when they are engaging with others, when they are not necessarily by themselves. Or sometimes you can also see the opposite effect where certain individuals, based on their personality, they may close up and not perform well on certain tasks. So that's the basis of that theory. But that's an example. I'm sure you've read about in other courses about tons of theories and how they're tied into what you're learning. And then we have from the text a quote here from the researcher Kurt Lewin that there is nothing more practical than a good theory. And that's kind of funny in a way, because a theory, again, it's not necessarily something that you might be able to hold in your hands, right? It's not necessarily something tangible, but again, it's a way to explain something that could be tangible, could be practical. So that's kind of what that quote is trying to get at. So now from a different perspective, we're going to listen to, again, another quick video. And I have a couple, if you haven't picked up on it by now, I know we had 2 of these in the first module, but I have a couple of these videos kind of sprinkled in throughout the different modules throughout the semester. I think not only because they were provided from the text as an additional resource, but also I think it gives you a break from hearing my voice the entire semester. So hopefully you do get something out of these videos. But now in this video, we have Dr. Glenn, Roberts, and he will discuss what a theory is. Again, give us a little bit more of a definition there when it relates to a theory. So just bear with me here and let me pull up that video. Just 1 second here, my apologies. All right, here we are.
A set of constructs that actually explain how a phenomenon works. It is a process so that you can actually look at how the process works. And in my opinion, theory gives meaning to data. And theory tells you what questions to ask, how to measure it, and then when you get the data, how to interpret it and make meaning of it. If you don't have theory when you do research, it can be very interesting, very descriptive, but the meaning of it sometimes may get lost. So it's a conceptual construction of how you think the psyche works. Well, a theory is important to practitioners because it actually tells practitioners what it is they ought to do to do what needs to be done. One of the big questions of motivation area is how do you get people to do what needs to be done? And what a theory does is actually give you the instructions, if you like, gives you the components to actually create that environment within your coaching or teaching or parenting environment to get them to do the things that need to be done. As we are often wont to say, there's nothing so practical as a good theory. And that's very true, because theory really does lend itself to practice.
Okay, so hopefully that was just another way for you to try to wrap your head around what exactly a theory is. Again, typically we just simplify that as a way to explain something that was previously unexplained. And it makes sense why that is important, particularly when we are seeing things with the populations that we work with in the discipline of sport and exercise psychology. So now we have a couple terms that we're going to throw at you. And what's important about these terms is depending on what resource you read or what class you're in, the definitions may vary slightly in terms of how they're categorized, but essentially, regardless of what names we give the things that I'm about to talk about next, the premise stays the same. When I mean the premise stays the same, that means that experimental research always has a causal effect, and everything else pretty much can be grouped in a type of descriptive or observatory manner. So, for our purposes, let's simplify it and think about studies versus experiments. So, in a study, the researchers they seek to observe or assess without changing the environment in any way. So, in our context, what that means, particularly as it relates to someone being a sport and exercise psychologist, this might be a situation where, let's say, if you are hired by a professional team as a sport and exercise psychologist and you're trying to and your task with the uh, goal, or I should say with the job of trying to understand what are the inner workings of the team morale. There might be a disconnect in terms of nonverbal communication when the team is playing whatever sport you want to imagine. So your job is to see what goes on in practice, what goes on during games, that lends itself through nonverbal communication, which ultimately leads to poor communication and is obviously a detriment to the team's success. So you may want to conduct a study in which you are simply just observing, right? Simply you're a fly on the wall, trying to listen in to what people are saying, whether or not teammates are encouraging themselves, what coaches are saying to their players. Maybe you're interested again in that nonverbal communication, how the players look at one another, if they're paying attention to one another, how they participate during drills, so on and so forth. So you didn't change anything about the actual landscape of what was going on, but you just wanted to observe, you wanted to see what was going on. And that would be a study, at least in the context of our text. An experiment, a little bit different. We are now manipulating variables while observing them. And then we're seeing how an independent variable affects a dependent variable. Now, if you haven't heard those before, let me just quickly define those for you. So an independent variable is a variable in a experiment that the researcher, the investigator, however you want to name them, they manipulate that. They change that. They lead to a situation where that becomes a point of interest to put people in a group or another. So for instance, if you wanted to see if think the example I just mentioned, and you wanted to see if a certain coaching technique that you wanted to try in terms of encouraging the teammates to have positive reinforcement, you might have a situation where, let's say it's a football team, and then same team that I was describing earlier, but then you want to see if one particular position group, let's say it's the defensive backs, right? If they're when they're doing their own position specific drills at practice, you encourage them or you take them through some sort of training in which they are recommended to provide each other with positive reinforcement during drills. So what does that mean? That means that the independent variable is the training of positive reinforcement, because you have one group, the experimental group, in this case, the position group of the backs, those position players, they are receiving the positive reinforcement versus the other groups, the other players, they're the control because they are not receiving this experimental condition. Sometimes we also call the experimental condition treatment condition. But to take it a step further, in that case, the dependent variable, based on the example I just gave, the dependent variable, remember, is the variable that measures the outcome or measures the change, the effect of the independent variable. So the independent variable, again, affects the dependent variable. Dependent variable is dependent on the independent variable. So in the example that we're going with, positive reinforcement training is the independent variable. That is the thing that is being given to one group, being manipulated to one group, causing one group to be the experimental group and the rest of the players to be the control group. And you might measure it by, let's say, uh, performance. So, if those certain group of defenders, they end up having throughout the season, they end up having more interceptions or uh, so on and so forth. And let's say maybe there's safeties or another subgroup of position players. So hopefully you kind of get what I'm getting at with that. Where again, if you introduce something into an experiment, when you introduce it to a certain group, that group typically will be your experimental group. The ones that don't get it or maybe get something different, that's your control group, or get the status quo, the bare minimum. And again, how you're measuring that change, that is the dependent variable. So let's talk a little bit more about that difference, because that difference is really important. And we're going to watch just one more video for this module from Dr. Deborah Felt. And again, she's going to further highlight some differences between uh, studies and experiments. So let's go ahead and watch this video.
Well, a true experiment involves random assignment to conditions. So at least one treatment condition and a control condition. And you need to manipulate an independent variable. So you might randomly assign some participants to a self-talk condition and others to a control where there's no self-talk prior to performing some exercise or some sport task. And other places, other conditions, you might not be able to manipulate. You can't randomly assign people to a female condition and a male condition, for instance. So that wouldn't be an experiment. That wouldn't be a manipulated independent variable. So there has to be at least one manipulated variable. In a study or in a quasi-experiment, you can't do the randomization. You might have people in one school compared to people in another school, and you give school A a certain treatment, the sports teams in that school, and school B acts as the control. But they're not randomly assigned. In a study, you are not manipulating variables, but you are observing, using surveys, perhaps, over time to see how maybe cognitions, maybe other behavior changes. So those are primarily the differences. In an experiment, in a true experiment, you can look at cause and effect. So if you manipulate self-talk, give one group self-talk, the other is a control, and you find that self-talk improves their performance, then you can say that self-talk causes an improvement in this performance. But you don't know if that works in the real world. You don't know if there might be other variables that might be contributing to this. So that can be complicated. It can be complicated in sport. There might be also instances where it's impractical or maybe even unethical to manipulate a variable. So if you want to look at how scholarships for athletes might reduce their intrinsic motivation to participate, you couldn't randomly assign some athletes to scholarships and other athletes not. That really wouldn't be ethical. It probably wouldn't be very practical to do as well. So if you select, however, scholarship athletes and non-scholarship athletes and look at their intrinsic motivation, you have other problems. You have maybe the scholarship athletes are more talented than the non-scholarship athletes. Maybe they feel like they're expected to do more and they're become less motivated because of that. So you have to control a lot of the other variables if you're doing a study, but those might be some reasons why you would do a study over an experiment, and some reasons why you'd want to do an experiment over a study.
So a couple really important things that were brought up in that video. Let's go back to our presentation here. We're gonna go back to this slide, and I like to be a visual learner myself sometimes. So let's go ahead and draw some things out for us here. Just bear with me here. Sometimes the toolbar gets hidden on me. Okay, so let's say if we have, oh, let's go there. So let's say here we have a collection of 10 athletes. Let's say there are 10 basketball athletes. Now, if you wanted to do, again, an experiment, one of the key factors of an experiment existing is the fact that there has to be random assignment. So let's say if we wanted to split this group of 10 basketball players into two groups of equal sizes, 5 and 5. So 5 up here, 5 down here. And these 5 we're going to receive, again, just going based on Dr. Deborah Fultz's example, self-talk. Versus the other 5, you're not going to receive anything at all. Now, to randomly assign them, there has to be a way to randomly put 5 of those in one side of the group. So one half of those in the experimental group, and then obviously the other half stay in the control group. You may do that by picking numbers. Maybe put their names in a hat and you randomly pick 5 names or 5 numbers, whatever the case is. You might put their names in some sort of computer generated program that randomly does it for you, but you get the gist of it. You find a way to randomly do it. And then after that, obviously, the presence of self-talk as an intervention, that is your independent variable. And then you might see their performance on, points per game or rebounds per game or injury, whatever you want to measure. That is your dependent variable. So you're seeing how the groups vary in terms of whatever, again, that outcome that you're looking for, that dependent variable. But let's say if the coach, before you start your experiment, says, well, I don't think it's fair to give only 5 of my athletes the self-talk program, which, theory shows and theory tells us that it's a positive thing. So the coach says to you, I don't think it's fair to give only 5 of my athletes this self-talk program coaching and not the other 5. And then you, as a researcher, you kind of agree with that. So then what you might do is you might look at a different study where you give all 10 some sort of self-talk programming, but then maybe you're interested in looking at differences in position, maybe starters versus non-starters. So from then, now all 10 are getting self-talk intervention, but instead of you separating them, you're giving them all the same thing, which again, she used the term quasi-experimental. So sometimes quasi-experimentals and studies, they may be the same thing or similar. But in this case, you're introducing this into the equation, but you're not changing anything else about what one person gets, what one person doesn't get, and then you just follow them over time. So make it real simple for you. Every experiment needs to have 2 things: random assignment and the creation of ultimately random assignments, which leads to a control group and an experimental group. Important to remember that. Okay, so let me go ahead and clear this. Just bear with me here. Okay, great. All right. So hopefully that did make sense. Here are some other examples that you could see. Let's say example of a study: 100 runners complete a survey that assesses goal setting, imagery, and self-talk. Again, nothing has changed in the environment. And then you're looking at, once you have the responses, you might consider looking at the ones that were faster and slower and then seeing if there was a change. Perhaps maybe you're looking to see if the runners that were faster, maybe they reported, using more of the goal setting imagery and self-talk techniques. But again, you didn't put people into groups. You just looked for something, again, maybe perhaps with the use of a survey over time, right? You assess change over time, but you didn't change anything in terms of what people got or what condition they were in. An experiment, different. Like we said, there has to be, let's look at this example, there has to be a random assignment. So from the beginning, runners are divided into two equal groups. They're randomly assigned. One group is going to get the settings, goal setting training, imagery training, and positive self-talk training, and the other group, the control group, doesn't get any training. Both are measured. And then you start to see if there's a difference between both groups, particularly if you start to realize that the experimental group is outperforming the control group, then you can start to say things such as the different levels of psychological skills training, again, setting goals, imagery, positive self-talk, is having an effect on performance. We call that a cause and effect relationship, a causal relationship, and only experiments can determine causal relationships, causality. Everything else, especially studies, they can determine correlations, relationships. We can say things are related to one another, but only when a true experiment is run, that's when you can say this causes that, X causes Y. If it's not an experiment, again, if it doesn't have random assignment, if it doesn't have the grouping of individuals in that experimental and the control group conditions, if it doesn't have that, then it's not an experiment, and it doesn't have causality, it doesn't have cause and effect. Really important point to remember. Causality, again, huge part of having an experiment, of doing an experiment. Okay. The back end of this chapter, we're going to highlight some things of looking at sport and exercise psychology, not necessarily just as a science, but also start bringing in the elements of the art of coaching. So we already talked about the science of it all as it relates to the science of coaching, teaching, leadership, using specific scientific general guidelines, something we can consider. But also what's interesting is something that we're going to talk about this semester is something known as the art of coaching, teaching, or leadership, which is essentially knowing when to utilize the different techniques that we will talk about. So, we already mentioned a couple of them, such as setting goals, imagery, positive self-talk. Every athlete is different, just like every person is different. So just because you think or you learn, or the researcher finds out that something has a positive effect, there's a place and a time for everything. As you see here, one of the terms that I have there for you that I really like is contextual intelligence. Think about this. If any of you have a friend who seeks to know everything, maybe you have a know-it-all friend, right? Someone that always knows stuff. And sometimes that knowledge is a little bit unnerving, or they're always trying to push their knowledge onto you, and it's a little bit uncomfortable, or it doesn't fit the mood of the room or the group of people that you're in. This is similar to that, because again, the different things that we'll cover, the techniques that we'll cover as part of sport and exercise psychology, there's a place and a time for them. Contextual intelligence is critical and crucial. In this video, Dr. Wade Gilbert, he just talks more about contextual intelligence and the importance of looking at the art of coaching as part of sport and exercise psychology. Um, we're not really going to spend time on here. We're going to go through this and move on to our next piece here. So we're going to get into now a conversation of the three approaches of sport and exercise psychology. These approaches are the psychophysiological orientation approach, the social psychological orientation approach, the cognitive behavioral orientation approach. And again, we'll talk a little bit more about these today, but also a lot more as we go on through the semester. So the psychophysiological orientation approach, people that take this approach as it relates to sport and exercise psychology, again, they're really focused on that relationship between the body and the brain. So the brain and the rest of the body. So again, we're looking at underlying psychophysiological processes of the brain that cause behavior. For instance, maybe someone that's interested in this type of research in sport and exercise psychology, again, that's psychophysiological. They might look at something as biofeedback to train marksmen. So individuals maybe in riflery that are shooting, maybe they're interested in what parts of their brain are firing when they do certain motions, or is there a difference in the biofeedback from the brain to certain muscles, or throughout certain muscle activities in those that are skilled versus those that are not. So again, another way to name this orientation, this approach, is sport neuroscience. And again, this is something that's emerging as part of this way to look at sport and exercise psychology. And again, the emphasis here is to look at brain behavior links and see the difference there. And again, another example, some other examples that you can see there, differences in brain activity, brainwave activities, particularly when you're looking at novices compared to professionals, and also maybe looking at other types of activity levels, obviously dealing with the brain, dealing with biofeedback and that sort of thing throughout different parts of motion or different parts of exercise. The social psychological orientation here's really focused on behavior. Behavior through this approach is defined as a complex interaction of the social environment and the personal makeup of the athlete or exerciser. So, differences among if the athlete is an individual sport athlete, a group athlete, if the person is participating in sport or activity in a certain environment around certain individuals, those are the kind of things that are thought about through this approach. And lastly, our third approach, cognitive behavior orientation, this approach really harps on the fact that both environment and thoughts, cognitions, those two terms are used interchangeably, are what come together to form behavior. And an example from this approach would be, as you see there, studying differences in confidence anxiety among tennis players with or without burn. So again, that focus on the environment and thoughts. So again, just quickly to recap, we have our three psychophysiological orientation approach, which is concerned with the relationship between the brain and the rest of the body and how that effect plays into physical activity. We have the social psychological orientation approach, which plays into really focusing on behavior and how behavior changes as a result of the environment, who that person is around, and who the types of people that are around that person, who those people are. And then lastly, our cognitive behavior orientation approach, that relationship between the environment and also the person's own individual's thoughts, cognitions. Okay, and then on the back end of this chapter, we're just going to fly through a couple important things that I want to highlight. So, looking at sports exercise psychology as a discipline, we saw in chapter one that obviously now, really since the year 2000, more and more people are taking this seriously. People are interested in learning psychological skills and applied work. They realize that, especially those that are not even always elite, but predominantly from a publicity standpoint, the elite, but really anyone that does physical activity that wants to take their ability to the next level, they want to learn the skills, right? The skills to sharpen their mind just as much as your body. They're more of an emphasis on counseling, clinical training for sport and exercise psychologists. So again, we're seeing more of a case in which athletes have mental health issues, substance abuse, body dysmorphia, uh, depression, anxiety, so on and so forth. So it makes sense that when we talked about those two specialties, remember that one of those, the clinical sports psychologists, those were of the two specialties, those were the individuals who they were actually licensed, right? They could deal with those mental illness conditions versus the other specialty, the educational sport and exercise psychologists. They were more obviously on the academic side and sometimes counseling side. And obviously, if they worked with athletes that they believed were succumbing to a mental illness, they would refer them out to a clinical sports psychologist. It makes sense that clinical sports psychology is getting more popular. Ethics and competence issues are getting more emphasis, specialization and new subspecialties are developing. So we talked about just those two, but even within those two, you can branch down further and there's subspecialties within those specializations. Unfortunately, some poor, I would say, distinctions of as the profession moves forward, the discipline moves forward. For whatever reason, there is still a little bit of tension between the practitioners of academia and applied sports psychology. So, sometimes, and sometimes disagreement is healthy. So, this isn't necessarily a bad thing all the time, but you have some sort of, again, tension between those that teach this type of material in the academic setting versus those that actually use it for whatever reason. Sometimes I'm not necessarily all that understanding of why people have to disagree when it comes to something like that. But it is important to point that out. Qualitative research methods are receiving more attention, but it's also important to not ignore quantitative research. So that could be a potential flaw that we see as it becomes fleshed out moving forward. And what's interesting is although the use of sports psychology, especially applied sports psychologists, is becoming more common, it's definitely not as common as other professions. And because of that, when you think about employment opportunities, aside, unless you're working for, a college or a professional sports team, there are very few opportunities again for full-time positions. So it's very difficult sometimes for those that are interested in going to school for this type of material for them to continue to bolster their career in full-time positions. It's not impossible, but maybe a little bit harder in some other psychology realms. But I think ultimately, it's safe to say that sports psychology is gaining increased acceptance and recognition of its usefulness, which is ultimately something that's very good and we can all agree upon. And then some other important concepts just to point out there, it's continuing to become multidisciplinary. Technology is changing rapidly. So again, sports psychologists are using these technologies to continue to improve the things that they seek to do. Like many disciplines, there's an emphasis of increasing cultural diversity and understanding how not just the use of the different skills that we'll talk about throughout the semester, how those can affect performance and so forth, but also differences within cultures, ethnicities, so on and so forth. And it's important to embrace those concepts to, again, consider them as just as important as the skills that we'll learn as factors that do change performance. And what's good to see is, again, applied sports psychology is becoming more professionalized. There are conferences, there are more articles now than ever before. There are certifications, there are just more professional outlets for the discipline that definitely were not the case 10, 20, definitely 30 years ago, again, before that main time point of the year 2000. Dr. Eric Bean, again, we're not going to watch this video, but what he does in this video, he continues to talk about the growth of the field of sport and exercise psychology, and really just gives a little bit more detail on the points that I just hit. But I think for time purposes, we're not going to watch this video. But again, definitely more on this in your text. Dr. Charlie Brown, something very similar there. Okay, as we wrap things up, I do want to point out that um, you do see sports psychology used outside of sport. And I think if you've ever worked with, or you are yourself, let's say an athlete, whether a high school athlete or college athlete, you understand how things that you learn in sport or even physical activity participation, even if it's not organized sport, you can take those lessons and apply them to the business world or to other professions. So this is what you see. So when things like, self-talk and leadership talk and imagery and positive reinforcement and so many other things that we're going to spend plenty of time on throughout the semester, when those things are learned in sport, obviously they help the athlete succeed, but again, they can be taken into the business realm to help those individuals succeed as well. So it's not uncommon, it's not unheard of to have sports psychologists working in business oriented settings and helping those individuals succeed as well. Ultimately, sport and exercise psychologists, whether they are clinical sports psychologists or they're educational, academic based sport and exercise psychologists, they are held to ethical standards. They have to be competent. They have to continue to understand the ever-changing discipline. They have to keep up with readings in the profession. They have to understand when things change, when new research comes out. They have to understand their own credibility, particularly as it relates to licensing. We know, again, there's a clear difference between uh, clinical sports psychology and educational sport and exercise psychologists, in which the clear difference being that one can deal with mental illness issues on the more deep level, while others cannot. Integrity and professional and scientific responsibility. Again, these are the ethical standards that, regardless of the specialty, sport and exercise psychologists are and will continue to follow. Three more that I'll add on: respect, concern, and contribution. So, again, like really any other profession, there needs to be a respect for people's rights and dignity, particularly when you start looking things such as questions that need to be answered through studies and experiments. Of course, you heard in the video that we watched from Dr. Deborah Feltz, there can be unethical, or there can be ethical concerns when it comes to certain topics. We want to be careful of that. There has to be a level of concern, a contribution. And then again, another video here that we won't spend time on, but Dr. Ed Ethel, what he does is just continues to belabor the points of why these ethical standards are important. But I think we kind of understand, even by just reading these, I think we can get a good understanding of why they are important. But be familiar with these six, right? Competence, integrity, professional and scientific responsibility, and of course, respect, concern, and contribution. And that is it. So again, we're going to move on to our third module next. And hopefully everyone had a good day or has a good day. And we'll talk soon.